Hello class, I'm going to talk somewhat about stress and coping, a continuation of our comfort concept. Up on the screen, I just provided you somewhat of an outline of many of the most important terms and concepts associated with stress and coping. I may not talk about each and every one of them, but I just wanted you to get the most important aspects of your reading assignment. I may show periodically throughout this lecture a few videos that we would have shown you in class had we had class today. So bear with me, it may not be done perfectly, but at least you'll get much of what we would have went over in class today had we conducted class. I'm going to show you first of all a very short video about what happens to the body physiologically in their response to stress.
The stress response. In stressful situations, the body switches on its autonomic nervous system and neurobiological processes in an attempt to maintain homeostasis. The body is prepared for its reaction to stress. In the brain, the hypothalamus is connected to the pituitary gland. The hypothalamus, stimulated by the sympathetic nervous system, releases the hormone corticotrophin-releasing factor, CRF. The CRF activates the pituitary gland to release the adrenocorticotrophic hormone, ACTH. This in turn alerts the adrenal glands. The adrenal glands are located on top of each kidney. The ACTH from the pituitary gland stimulates the adrenal cortex to release cortisol. At the same time, neurons in the hypothalamus signal the medulla to release epinephrine, adrenaline, and norepinephrine, noradrenaline. These hormones then push the body into hyperalertness.
That video, as you could see, was just a little review of what exactly happens, kind of like that stress response that happens within our body. For the time being, when we do have a stressful event and that physiological response happens, our body can somewhat get over that situation. Your heart pounding, blood pressure going up, the release of glucose for energy to deal with the stressful situation. But the problem is, when we as people experience many stressful situations, that stress response repeatedly occurs. And after a while, this could be very detrimental to one's health, and we could start to see someone get very ill over the continuous stressors that they're facing due to the fact that this physiological response continues to happen. This is where people might be more at risk for high blood pressure, heart disease, diabetes, things like that, because that physiological stress response continues to occur because that unfortunate person continues to have many stressors in their life. And each one of us really does establish how we cope with the many stressors that unfortunately life hands out. And a person does learn to cope from significant others during their early childhood and even throughout their life. And the ability to cope is greatly affected by the number and the severity of stressors that have occurred in a person's life. And that makes sense. Some of our patients who come in that have had a lot of problems with their health maybe might adapt a lot better than somebody who has been healthy all their life and then all of a sudden they're kind of dealt with a really very serious illness. And for them it's very hard to cope and even accept the fact that maybe they have a terminal illness because for maybe 40, 50 years they've been leading a very healthy life. And many times we see people who really do not handle the stressors of life very well really start to manifest stress-related disorders. Maybe they have frequent headaches. Maybe they develop asthma. Maybe they develop skin rashes, back pain. Maybe they're sick all the time with cold, sore throats. Maybe they're more prone to the flu. And maybe their stressors really produce a lot of anxiety in that person's life. And many times as nurses, when we do that initial assessment on our patients, we're always looking for those assessments, findings related to bodily functions, but we should also be really listening and observing to kind of detect if our patients have a lot of stress in their life and really what kind of ways in which they deal with that stress. And I had told you at the beginning of this course that nursing school can be quite stressful for you, and that it's important to establish a way in which you can hopefully minimize your stress and have various mechanisms and coping mechanisms to deal with the many stresses that you obviously are going to face as you're in nursing school, because sometimes it isn't just only nursing school you're dealing with. You might be having issues at work, you might be very stressed with your family situation, so that may definitely affect how well or how you perform in nursing school with testing, your clinical performance, and then just being present when you come to lecture and lab. And the same goes for our patients. Your book in Barbarito on page 94 really does give you a way in which you can kind of ask questions to your patient to kind of determine, if there is a lot of stress, and if there is, how well does that patient cope with that stress. And many times what we worry about when people have not really established any effective coping mechanisms, this can various times lead to some of these maladaptive behaviors that your book talks about, self-directed violence, and of course suicidal ideation. And we know from our experiences as adults that we have to take any type of suicide very seriously. It still is a major health concern in the United States, and as your book points out, in 2009 the number of suicide-related deaths exceeded the number of deaths due to motor vehicle crashes. And I think that's really important to listen to people when you feel and see that they really have a high level of stress. How are they coping, and how are they dealing with that stress? It's important to look at stress. What is stress? Stress is really the body's general, non-specific response to the demands placed on it by a stressor. And from your reading, you can see that Dr. Hans Selye, he was an endocrinologist and someone who really, really looked and studied stress and the stress response. And I think what's really important in his study and what he concluded was that not all stress is bad. In some cases, he did say that stress can help an individual achieve desired goals or exceed those self-imposed limitations. And he calls good stress eustress, and that's associated with accomplishment and victory. And obviously, we're very familiar with the opposite of eustress is distress, which is a stress that is associated with inadequacy, insecurity, and loss. And many times, as human beings, we feel very distressed. We're in a state of distress. And other terms that are really important, especially by Sterling and Iyer, they originated the term allostasis, which refers to the changes necessary to achieve the characteristic stability of homeostasis. And we know what homeostasis is. That's the body's ability to maintain vital functions such as heart and respiratory rates, oxygenation, and glucose levels within an ideal range. And we know that a lot of the literature does describe allostasis as the process the body uses to maintain a pathophysiologic deviation from the normal homeostatic operating level in the presence of stressors. And that's exactly what I just showed you on that video, that is the body's adaptation to stress and how it's able to cope with that stressing situation. And we know that with every stressor, there is a stress response. And that's that physiological change that is triggered by the stress. And that's what activates the neuroendocrine and endocrine systems, as well as activation of many of the target organs. And we know that the two primary stress mediators are glucocorticoids and catecholamines, and these are the ones that's responsible for increasing blood pressure, increasing heart rate, increasing the release of glucose. And these hormonal stress mediators are intended to promote adaptation by definitely triggering that increase in heart rate and blood pressure when faced with a physical danger. So the body's kind of giving you all the necessary tools it needs to kind of fight off the stressor, okay? Glucose is given, increases your blood glucose because we need glucose for energy, and your body says, hey, I'm giving you more glucose because you may need more energy to combat or work through this stressor that's being presented to you. And many times when we talk about stress, we're going to have stress no matter who we are, but the really important aspect of stress is really about coping. And coping is that process through which an individual applies cognitive and behavioral messages to handle those internal and external demands that the individual perceives as exceeding his available resources. You know, there's an old cliche out there that many times they say you're not given stress unless you can cope with it. But I'm not sure that's true. I think so many people out there are really given a lot of stress and really unfortunate situations, and maybe they're just at their limit of how they're able to cope with such an unfortunate situation. Your book talks about the many types of stressors that unfortunately happen, and we look at those and we can kind of categorize those as one being a biogenic stress. And that's a stress response without any necessary cognitive process on the part of the individual. Common examples of a biogenic stressor is you don't realize it, but just drinking 4 or 5 cups of coffee with the caffeine is definitely putting stress on your body. Extreme temperatures, just like we're facing today. Amphetamines, all those we may induce on ourselves, but they are definitely putting stress on our bodies, and we call those biogenic stressors. And then there's some psychosocial stressors, and sometimes those can be either real or imagined. And then rather than directly triggering the stress response, psychosocial stressors can facilitate its activation, depending on how the individual perceives that stressor. Meaning that, say for instance, as your book points out, you have a real fear of heights, and I personally do. So they're trying to deal with it, so they may respond to cleaning the gutters on our house differently than an individual who is not afraid of heights. So that's a couple examples of the type of stressors that we may face. And you have to also think about, too, from the standpoint of the duration of exposure, stressors can also be classified into 4 categories: acute and time-limited, sequential events following an initial stressor, chronic intermittent, and chronic permanent. And your book in Table 31.1 does give you examples of those kinds of stressors. So what do we mean by those classification of stressors? When we talk about acute and time limited, an example would be during a test. If I'm passing the class out a test, you are going to be stressed for just a very short period of time. It's a quick onset of stress, and then once you take the test, that stressor is gone. When you go to take your NCLEX exam, you're going to be very nervous, you're going to feel some stress, but once you take this test, that stress hopefully will be alleviated. The next one is a sequential event following an initial stressor. Maybe you lose your job and you're trying to find work, and because of the loss of your job, you can't pay your bills, and unfortunately you have to file for bankruptcy. You can see that a certain event occurred because of that initial stressor. Another one is a chronic intermittent, and that might be, say for instance, you have to have some kind of repairs done to your house. Maybe your basement leaked and you had to move in with your in-laws. And so it really has become a very strained relationship because you had to live with them for a few weeks until your basement was repaired. Another chronic intermittent stressor would be maybe you and your siblings. You have a sister, you have a brother, maybe you have a very ill parent, and you both are sharing the care and responsibilities of that elderly parent. And then chronic permanent, say for instance you were in a car accident and you became paralyzed. That obviously is a chronic permanent stressor. Maybe you end up with neuropathies due to your diabetes and you end up going blind. Obviously that's a permanent stressor where now you have very, very serious visual problems. And again, we have to look at our lives, and one thing that we all have is what we call and label as daily hassles. And those are those individual day-to-day stressors and tensions that we face. And definitely give us a lot of stress, and sometimes we can't cope very well with them. And many of those could include, obviously, taking care of your kids, taking care of a household. Maybe you were up all night with a child and you have to go to work the next day, or you have a class the next day, or maybe you have a test the next day. And many times, people obviously have more daily hassles than other people. I mean, just paying our bills. Maybe you have to face a lot of traffic driving into work every day, and it gets more and more stressful each day you go to work. Maybe your neighbors really present a lot of stress. They're noisy. They're, that they party a lot. This is a daily stressor that you have to face all the time. Those are what we call daily hassles. But then we can also have internal stressors, where sometimes our own thoughts or our cognition really presents a lot of stress. Our spirituality and our emotions are all ways in which we can definitely have internal stressors. What about environmental stressors? Today, if you had to go out today, these incredibly low temperatures can be very stressful. Think about the other environmental stressors that have occurred, living in a war zone, facing a very devastating hurricane. Maybe somebody has been in a flood area. Think about out in California, the many wildfires that occurred where people lost their homes. What about some of the major changes affecting one or a few people? A divorce. Maybe you lost a parent, and it's very, very hard to cope with the death of somebody very close to you. When we talk about the internal stressors, Those do include the physical, spiritual, cognitive, emotional, and psychological well-being of an individual, and really depends on the satisfaction of basic human needs. And according to Lazarus and Folkman, the drive to fulfill human needs internally sparks the stimulus to produce energy to seek gratification. We have to also look at the spiritual dimension of the human condition as part of the individual's internal environment. And, you know, spirituality may mean a lot of different things to a lot of different people. But according to your book, Ducey and Keegan define spirituality as the essence of who we are and how we relate to the world. And they incorporate a lot of things in spirituality that include our individual values, our place or fit in the world, and a sense of peace. And a lot of the research has definitely identified that interconnectedness with the self, individuals, and the world around us are as important components of spirituality. As far as the environmental stressors, in which I provided you many of the examples of that, they include a lot of things outside of the individual that demand change or definitely disrupt homeostasis. Some of the positive stressors, because remember, many of the researchers feel that some stress can be good, and a positive stressor would be your graduation from nursing school. And they hopefully will produce that eustress, which is that positive stress. But there are negative stressors. Maybe you get out of school and you're got a job, and maybe you're not working the shift that works the best for your family. Those can tend to lead you to a state of distress. And we look at that coping process, and we know what coping is. It's the process by which individuals can control or modify their responses to stressors. A lot of times people really do have good coping mechanisms where it really allows that person to maintain a return to homeostasis in a reasonable amount of time. And there's a nice table on 31.2 in Volume 2 of your concept books where it really talks about the factors affecting an individual's stress response in a genetic predisposition. Our past experience coping with stressors, ability to meet own basic human needs, cultural beliefs and customs, holistic health and well-being, a personal worldview and appraisal, and coping mechanisms and a history of coping successes. And some of the environmental factors might be family support and connectiveness, community support, financial resources, community resources, access to health care and education, family appraisal, and social support. So see, we can kind of put those in two separate categories of individual factors versus environmental factors. And the term cognitive appraisal is very important when we're talking about stress and coping. Cognitive appraisal is really a very important issue when we're talking about how the person is able to cope with their stressor. So, for instance, a person does experience a stressor. He appraises that stressor, he kind of assesses that stressor and kind of looks at it. And he kind of sorts, assesses, categorizes, evaluates, and frames the significance of an event or stressor with respect to his own well-being. And so this is what we call that primary appraisal, or it's that first impression. So a stressor occurs, and of course right away we make a judgment about that particular stressor. And based on the transactional model, which is described in detail later, and I'll talk about that particular model later on, there are 3 ways in which an individual categorizes that particular stressor or demand on their body. They can either find it irrelevant, they can either look at it as being benign or positive, that it's not going to do a lot of harm to themselves, or they can really say, oh my gosh, this is really stressful. And when we say that they're irrelevant, maybe that stressor in that person's life can say, it really doesn't have any meaning or any effect on me, or there's no circumstances or consequences that are going to occur because of the stressor. So it's then just disregarded. Benign positive stressors are demands for change that are perceived as preserving or enhancing the well-being, such as taking a driver's education class. Stressors or stimuli that are categorized as stressful include those that may be harmful. They may be very threatening or very disturbing. An example of that would be a death of a parent, a death of a child, because this really is a threat to your life or to even your safety. So that's what primary appraisal is about. There can be 3 potential responses when a stressor first comes in someone's life. Then we look at the secondary appraisal, and that's the individual's attempts to predict the impact or the intensity or the duration of that particular coping behavior necessary to be able to deal with that particular stressor. So now what they're going to do is they're going to select a coping response. And in some situations, the intensity of an individual's stress response may be incongruent with the stressor. And what that means is if there's a very, very serious stressor that occurs in one's life, some persons may demonstrate a response that is very mild in intensity faced with that devastating response, and others may really kind of behave in a very extreme way. Maybe they lose a family member and they say, hey, I can't live without that person anymore, and they may talk about suicide or hurting themselves. So those are things that you want to definitely think about. And for instance, if we kind of look at that in regards to students in nursing school, some students may think that if they get a C, that's being successful, because obviously you've passed the course. But other students may say anything less than an A is very distressing to that student. They're very stressed about it and they want to do better. Okay? And keep in mind that each individual is unique because everybody acts differently to whatever stress is given to them. And we're going to talk in just a minute about Maslow's hierarchy of needs. And that really helps us understand the significance of stressors within the context of what we need as human beings. Okay? And so getting to Maslow's hierarchy of needs, he kind of introduced this concept back in 1943. Okay? And your book and your concepts too kind of shows the picture of Maslow's hierarchy of needs, starting out with the physiological, then like a stepping stone to safety and security, love and belonging, self-esteem, and self-actualization. And that just kind of shows us what needs are kind of at the bottom of that stepping ladder. And he even expanded that model to include self-transcendence as a 6th level of need. Okay, so it's important that you make sure that you'll look that over. Okay. As we continue to talk about stress and coping, we look at the manifestations of stress. First of all, looking at the physiological indicators. And what that refers to as the little video that I just showed you, where we have the involvement of the sympathetic and the neuroendocrine systems. And as I said before, on occasion when a stressor is encountered, that physiological response is very much important to occur, but when it occurs too frequently, that's when we see patients or people start to get sick. And then we have the psychological indicators. And these are people who start to manifest stress within that psychological domain, okay? And that's where they may kind of manifest problems with fear. And we know fear is a sense of apprehension triggered by a perceived threat to safety or well-being, including a painful stimulus or dangerous event. Then we could see someone become very anxious and develop anxiety. That's where they can feel very apprehensive, dread, mental uneasiness, and a sense of helplessness in response to an actual or even a perceived threat to the well-being of oneself or others. And that anxiety can be very minimal to someone that actually becomes debilitated with the anxiety. And unlike fear, the book talks about an individual's anxiety may not have an apparent identifiable cause. And we'll talk later on about anxiety. Another physiological or psychological response would be anger. It's a subjective sense of intense displeasure, irritation, or animosity. And what we worry about with anger is the fact that many times anger may start to escalate, which can obviously lead to very destructive emotional responses as well as very destructive behaviors. People can become more hostile, aggressive, or even violent. And the last one is depression. And that's that persistent feeling of emptiness, hopelessness, sadness, or despair. And sometimes associated with depression is a loss of interest, and we call that apathy. And then looking at these cognitive indicators, problem solving, cognitive structuring, and then suppression, which is definitely a defense mechanism, and that's the active conscious process of denying unacceptable thoughts or emotions. And I'll get to talking a little bit about some of those defense mechanisms. Please look at the picture on page 2055 in your book, looking at the multi-system effect of stress and how it really does affect the sensory, the endocrine, the urinary system, the musculoskeletal, other disorders that may occur because of high levels of stress, integumentary, respiratory, cardiovascular, and GI. You may not think that something that occurs frequently could have such a profound effect on the body, but it truly does. It really does make someone more at risk to developing cancers. It makes one more accident prone, and as we know over time, with more frequent stressors, it does decrease the immune response. We look at things such as self-control, where sometimes stress may cause someone to maybe behave in a way that they normally wouldn't behave and not have that self-control. Fantasizing or daydreaming, that imagination that kind of fulfills those desires or wishes that we kind of mentally picture, that kind of don't always occur in reality. Sometimes fantasizing can be healthy and may even lead to identifying solutions to problems. However, if we use it too much as a way in which we cope, we can really start to avoid reality and avoid many of the challenges in which we're going to find it harder to cope with those situations, and we may put on the back burner how we're going to resolve the problem that's occurring, or the stressor that keeps, kind of coming back to us all the time. One thing I'm going to talk to you about that really pertains to you as a nurse is burnout. And I'm going to show you a couple of videos on that. So we'll get back to that at a later time during this lecture presentation. The one thing I want you to pay attention to is looking at the chart on page 2057 talking about ego defense mechanisms. There are quite a lot there, and some of those are not as common as some of the other ones. Obviously, denial. I think everybody's very, very familiar with that particular type of defense mechanisms, and you may see patients actually exhibit this type of defense mechanism where they attempt to screen or ignore an unacceptable reality by refusing to acknowledge that it's really happening. And many times patients that are diagnosed with some very serious or terminal diseases will say that can't be true. I don't have cancer. I'm not going to die in 6 months. So those are kind of an example of what you may see, and so many times it may take a person a long time to process that information, where eventually they do accept what is being told to them. I'm not going to read all those. I think it's important that you look through those. They do give an example and exactly what the use or the purpose of why that person is exhibiting that kind of defense mechanism. And this outline does really define what a defense mechanism is, an ego defense mechanism is. It's that unconscious psychologic process for defending the personality. And as I said, make sure you review that chart. I'm going to talk a little bit about this nursing transactional model, which really is about emphasizing the individual's perception or cognitive appraisal of a given threat as being the most significant factor in the process. And it does threaten the individual's primary goals and values. And as I said before, those appraisals are kind of put into play, as I talked about earlier in the video. I want to continue with nursing burnout, because we in a profession that really does have a lot of stress in it are not exempt from the possibilities of facing incredible stress. And how as nurses are we going to be able to cope with that stress and still be at a high functioning level with our patients? And if we don't recognize that we have a lot of stress and that it's really getting to us because it's definitely affecting the way I care for my patients, that stress can really start to take a toll on someone. And many times, because of our very irregular work schedules, the increased demands that we have to do as nurses, staffing shortages, we are definitely a profession that's at high risk for burnout, okay? And when a nurse becomes burned out, this is definitely affecting quality of care. In fact, it negatively affects the quality of care. Patients will be less satisfied, and we also have the potential of that individual leaving the profession. And as I said, probably on the first day of class, we have an incredible shortage of nurses in this country, and we should be keeping our nurses happy and not even thinking about the potential for nurse burnout. But unfortunately, nobody's doing anything about it, and our nurses are getting burned out. I'm going to show you a few videos, and obviously we can't discuss them because, you know, you're going to just watch them, and hopefully you give some good thought about these videos in regards to nursing burnout or things that we can do to make the environment of where we care for our patients a better place for us and for our patients. So bear with me. I'm going to show you these videos that we would have kind of watched if we had had class today and tomorrow.
If you write anything on your computer, you need to get graphic.
I write pretty much all day, every day.
The actual meaning of stress is to quickly prepare your body for action in case of danger. But it also arises when we are, for example, worried. During stress, the adrenal gland produces 3 hormones: cortisol, adrenaline, and noradrenaline. Cortisol causes an increase in blood sugar, providing the body with a lot of readily available energy. Adrenaline and noradrenaline enable the body to perform quickly. This is also called the fight or flight reaction. Extreme or prolonged stress can cause your body to function beyond what it can voluntarily do. This can lead to various physical symptoms and disorders, or burnout. A burnout may be caused by prolonged exposure to stress at work, such as excessive workload, or too little recognition, combined with certain personal characteristics, such as perfectionism, excessive conscientiousness, and workaholism. During a burnout, you have no interest in your work. You feel constantly restless and tense, and you often suffer from physical symptoms, concentration problems, and forgetfulness. Other effects may include little time and energy for oneself and your family, increased drug use, high blood pressure, heart attack, stroke. If you have a burnout, it is very important that you see a doctor for help. He can refer you to a psychologist and possibly prescribe medications such as antidepressants or sleeping pills. During therapy, a psychologist examines the factors which have contributed to the emergence of a burnout. You will learn to take better care of yourself and to create more balance between your work and your private life. Furthermore, the aim is to let you get back to work as quickly as possible. It is also important to learn to relax, for example, by relaxation and breathing exercises, or by doing sports. A person who has a burnout needs someone that can encourage him or her to take the signals seriously, and someone who can join him or her to do relaxing things. Someone with a burnout should also be encouraged to seek help, because burnout is treatable. Your general practitioner can give you more information about the disorder and its treatment possibilities.
Jimmy is a recent grad from psychiatric nursing. After spending so much time studying, he is ready to join the workforce.
You look hungry.
After just a few months of full-time work, Jimmy is beginning to push himself to the limits.
Hey Jimmy, go for your lunch already.
Aw, jeez, I don't have time for that. Not today, I got way too much stuff to do.
Suit yourself.
I'm swamped.
Jimmy starts to notice how tired he has been getting. He has a pounding headache most days, his shoulder muscles are tense, and he is losing weight. Unknowingly, he is pushing himself too hard. This lack of energy is starting to show in his work.
Mr. Chase, I brought your medication here.
Jimmy, what are you doing? Those are Mr. Johnson's medications, not Mr. Chase's.
Dear God, she's right.
These aren't my pill, you idiot!
What was once an easy task for Jimmy has quickly become an area of difficulty. Jimmy is experiencing trouble at home, too.
Hey, honey, I'm home.
Hi.
Hi. You call this supper?
Yeah.
I said I wanted ribs!
Stop yelling at me. We never talk anymore. You've changed.
It is clear Jimmy needs help. It may take a great deal of self-awareness to recognize the amount of stress he is under.
Hey, Susie, can we talk?
Yeah, sure.
I think I'm starting to get burnt out. It's affecting my work and my home life.
Yeah, I've noticed you making some mistakes lately. I'm happy you came to talk to me. I suggest that you...
And so, Jimmy was able to recognize the change in his emotions, behavior, and physiology. The ability to recognize symptoms of stress is invaluable for nurses who are at risk for burnout. Jimmy did the right thing by going to talk to somebody about his concerns. One of the most important ideas that Jimmy kept in mind is, don't forget why you became a nurse, care for yourself and others.
Hold on for one more day.
Recommendations for burnout and compassion fatigue. So this is the story of two RNs, Stephen and Kathy. Both work in the same hospital, but on different units. Stephen is facing unrealistic expectations from his managers. They are not supportive. They give him negative feedback and blame him for mistakes. He works more than 12 hours per shift and does not have recovery time between shifts. He has increasing workload due to staff shortages. Because he is so exhausted, Stephen has started to make errors. Everyone is gossiping about Stephen and the mistakes he made. Stephen has lost his confidence and feels burnt out. On Kathy's unit, she receives continuing education in nursing competencies. She feels confident and up to date. Her manager has put a stop to excess overtime, so Kathy has time to spend with her family. This work-life balance helps Kathy to manage her stress. Kathy's manager listens to her ideas and is open, positive, and approachable as a leader. Kathy's unit also has fun activities to bring the staff together as a team and create a positive work environment. As a result, Kathy is happy and committed to her nursing career. So what is the difference between these two? Kathy's unit is the only one following recommendations for a healthy work environment. They use initiatives such as huddles to check how staff are coping with assignments, appreciograms to give staff positive feedback in their mailboxes, and respect posters to remind everyone how to interact and problem solve respectfully. So the end of our story is, due to his overwhelming stress, Stephen quit his job. Meanwhile, Kathy stayed at her unit. She felt happy to go to work. She became a good mentor for others joining the nursing profession.
Class, now I'm going to show you a movie that kind of shows you the future of hospital rooms. And I want you to kind of think about would an environment in which a nurse works in, would this really prove to help reduce their stress and really prevent a nurse from facing burnout? So go ahead and view this and just kind of think about what you saw.
The look of American hospitals has changed dramatically through the years, from luxurious mansions that cater to the extravagant desires of wealthy patients, to open gallery rooms after World War I, geared toward accommodating as many people as possible. These hospital designs seem to focus either on the patient experience or operational efficiency for caregivers. Ideally, though, hospital design should do both. Learn how evidence-based design in hospital environments can improve medical outcomes and lower costs here on Healthy Dialogues. When hospitals are well designed, clinicians and patients can more easily maneuver in the workspace and access equipment. This reduces stress and errors. Take Methodist Hospital in Indiana, for example. When they switched to single-bed rooms, the need for room transfers went down 90%. And because of this, medication errors also went down by 67%. Good design makes patients and their families more comfortable, too. In fact, one study showed a change as simple as installing sound-absorbing ceiling tiles resulted in patients reporting not only that they slept better and were less stressed, but they also perceived better care from their nurses. Even art on the walls can help patients be less stressed and reduce their need for pain medication. In 2008, it was projected that the U.S. would spend $180 billion in construction of new hospitals in subsequent years, replacing the aging designs of the 1970s. Intermountain Healthcare is doing just this in Provo, Utah. Some of the design elements of this hospital include larger all-private patient rooms, decentralized nurse stations outside each room that will allow nurses to be closer to each patient and have constant visuals into patient rooms, improved department adjacencies and treatment spaces that will physically bring together hospital services, and finally, a healing garden that will contribute to both physical and emotional healing. It's also interesting to know that while the rooms will be bigger, there will be fewer of them. As technology improves, we have more capacity for outpatient services and will therefore keep patients in the hospital for less time. When healthcare systems invest in improving the physical design of their clinical spaces, the results are improved health outcomes and patient satisfaction at a lower long-term cost. For more videos about transforming healthcare, please subscribe to our Healthy Dialogues channel.
I just want to share with you an example of a couple. This is two characters in what we call the neighborhood. This was another Pearson resource from an earlier class, but I just wanted to kind of provide you with this particular example of how everyone, no matter what the couple is, face a lot of stressors in their life. And we've got two gentlemen here, Greg Ross, and let's see what the other one's name is. We're in season 1, and we're going to go to episode 8. And Greg Ross is in a relationship with Benito Jaramillo, and apparently now we're seeing that Greg is facing some health issues, okay? And here's kind of a little bit of information about each of these characters. And I just wants to show you that we'll read this. Greg talks with Ben about the possibility of adopting a child or even perhaps fathering a child with a surrogate mother. Ben does not show much interest in the topic and questions Greg about how they will have enough time to raise children. He also points out that they already have everything they need, but Greg is frustrated with Ben's lack of interest, and his response underscores a character flaw he finds in Ben. That is, he's very self-centered and often selfish. And so Greg creates this journal about selfish people don't want to inconvenience themselves. And he knows that his partner, Ben, can be quite self-centered, but he thinks that he thought that the relationship matured, and as he got a bit older, he would outgrow it. And he really seems to think that maybe he can keep persuading his partner about this baby issue, and he thinks that his partner would make a wonderful dad. He loves dogs, and he dotes on them constantly, and he does have a basic nurturing side that would be great with a child. And so I just wanted to show you that you can see the particular stressor that's occurring in this relationship. And if you look at these two men in this relationship, you kind of want to ask yourself, is this the reason for the stressor because of the couple's diversity? Yes or no? Why or why not? And is there a possible solution to this? And then we look into episode 9, and after work, Greg drops by the pharmacy to pick up vitamins and a dietary supplement for Ben. He sits down at the automatic blood pressure machine and takes his blood pressure, and it reads 134/90, and he decides that his blood pressure is probably not that bad after all. And he also notices a pamphlet about HIV testing, and he feels relieved that he's in a monogamous relationship, believing he doesn't have to worry about any of these issues. So, I just wanted to kind of show you that no matter who you are, all kinds of things present stress in someone's life, especially when you're in relationships, families, and even friendships. So, just wanted you to kind of think about those kinds of things, okay? And lastly, I just wanted to show you this little handout that shows a nurse in the center of all this chaos and commotion, where she possibly may be able to handle a lot of the stresses in the healthcare work environment. You can see a lot of that relates to medication, bedpans, smells, the kind of cantankerous patient, looking at her work schedule, unfortunately dealing with death and dying. You've got somebody down here vomiting, and of course all the technology that's involved in the workplace. So I think you can kind of ask yourself these questions. How do you think this illustration relates to our discussion on stress? And why do you believe that nursing and stress management are topics of concern? They are huge topics of concern. When we're talking about the work environment, especially for nurses, all the responsibilities, and the possibility of facing nurse burnout. And I think nurse burnout is really happening a lot sooner than it did back in my day. I think because of all the demands, the nursing shortage, the acuity of patients, maybe some people were able to tolerate working 10, 15 years in nursing, and now all of a sudden we see some of the nurses out there, especially some of the new grads, only able to tolerate 2 or 3 years, and that is unacceptable. And we know that there are very, very serious long-term consequences of stress, which is not managed effectively. We know it can have a long-term effect on us physiologically as well as mentally. We talk about acquiring anxiety and all those other coping mechanisms. That is the only way that we can survive some of the stress that we're experiencing in our life. And think about yourself. I know you've only been in nursing for 2 weeks. You've only had 1 or 2 clinical experiences. But I want you to keep in mind that you will start to see a lot of things around you in the healthcare environment that really present stress and may cause you to become very fatigued. And how are you going to fix that? So this pretty much encompasses things that we would have talked about in class regarding stress and coping. Be sure you go through the reading. I kind of went through that reading with you to point out some of the most important pieces of that reading, and then hopefully you've enjoyed some of these videos, which really do kind of show very demonstratively things like nurse burnout. So let me know if you have any questions, and I hope you have a nice day. Thank you so much for your attention.